The purpose of this program is to demonstrate basic oral hygiene procedures for hospitalized or institutionalized patients. The focus is on bedside toothbrushing and flossing techniques, as well as removing and cleaning dentures. Oral hygiene care has particular significance for the comfort as well as the health of the patient. It should be an ongoing, regular aspect of total nursing care because regular oral hygiene will help prevent periodontal disease and other oral infections, prevent complications of the patient's medical condition, and contribute to the patient's comfort and general well-being. Toothbrushing and flossing for the bedridden patient who is alert and able to cooperate with you will be the first procedure demonstrated. Materials needed to perform this procedure are towels for patient drape, gloves, soft toothbrush, toothpaste, mouthwash, petroleum jelly, cotton tip applicators, tongue blades, emesis basin, floss holder, water, and cups. To begin, always tell the patient what you are going to do. Position the bed in an upright position. Then drape the patient's chest with a towel and glove up. Dip the toothbrush in water to moisten and soften the bristles. Then apply the toothpaste. Place the toothbrush at a 45-degree angle and brush on the tooth and gum with a short circular motion, starting with the back teeth and moving forward. Continue this brushing procedure until you have cleaned the entire mouth. Let the patient rinse as needed. Next, ask the patient to stick out his tongue and brush with gentle outward strokes. Then have the patient rinse thoroughly with water. After brushing is completed, floss the patient's teeth. Use a floss holder to simplify this procedure. Firmly grip the handle of the floss holder and gently insert the floss between two back teeth. Clean by moving the floss in an up and down motion, pulling it tight against the tooth being cleaned. Remove the floss and go on to the next tooth, repeating the procedure until all teeth have been cleaned. Now let the patient rinse with mouthwash. An anti-plaque rinse is recommended to reduce bacterial plaque buildup and rinse away loosened debris. After all cleaning procedures have been completed, put a small amount of petroleum jelly on the patient's lips using a cotton tip applicator. This helps to keep the lips moist. Throw away all paper products. Rinse the toothbrush and floss holder and return them to the bedside. All products used should become the property of the patient and should be left at the bedside for the next cleaning. Stop and review this procedure before continuing. You may want to refer to the instructional booklet for procedural outline. The second procedure to be demonstrated is toothbrushing and flossing for the unresponsive bedridden patient. Oral oral hygiene procedures for these patients require some special materials, but only a slight alteration of the previously demonstrated procedure. The materials needed to perform this procedure are the same as for the first procedure, with a few exceptions. You will need gauze squares and two specialty materials, a mouth prop and a bite block. The mouth prop is used to forcibly open the patient's mouth, and the bite block is used to keep the mouth open during the procedure. Notice that a piece of dental floss is tied to the bite block. This is a safety feature to allow for easy retrieval of the bite block in case it becomes dislodged during the procedure. You will not need toothpaste. Using toothpaste to brush the teeth of an unresponsive patient could cause him to choke or aspirate stomach contents. To begin, tell the patient what you're going to do. The patient may hear and understand, although not acknowledge or respond in any way. Next, position the patient in a semi-supine position if possible. If not possible, place pillows under the patient's head to prop it up slightly. As before, drape the patient with a towel, then glove up. Remove the mouth prop and the bite block from the sterile packaging. Insert a tongue blade between the anterior teeth and turn it sideways to open the anterior space. Insert the mouth prop at the side of the mouth and squeeze the handle to force the mouth open wider. On the side opposite the mouth prop, insert the bite block. The smaller side of the bite block goes toward the back teeth. Make sure the dental floss is long enough to hang out of the mouth and that the biting surfaces of the teeth are securely on the bite block. Remove the mouth prop by releasing the catch and set it aside. You are now ready to start the toothbrushing procedure. Dip the toothbrush in water and then in an anti-plaque mouthwash. Shake the toothbrush over the cup to remove excess water and mouthwash from bristles. Too much liquid could cause the patient to choke. Use the toothbrushing technique previously described. Clean the upper and lower teeth on the side without the bite block. Redip the toothbrush as needed in water and mouthwash. Then floss using the floss holder. Brush the tongue and the roof of the mouth to remove debris and dried secretions that may accumulate from tube feedings and medications. Clean the brush often by dipping it in water or wiping it with gauze squares. Insert the mouth prop back into the area of the mouth that you have just cleaned. Open the mouth just enough to allow the bite block to be removed. Close the mouth prop slightly and slide it over to the opposite side of the mouth. Reinsert the bite block on the side of the mouth just cleaned. Remove the mouth prop and repeat the cleaning procedure on this side. Reinsert the mouth prop and open the mouth just enough to allow you to remove the bite block. Then remove the mouth prop. Apply petroleum jelly to the lips with a cotton tip applicator to retain moisture. throw away the paper products. Leave the brush, floss, and the mouthwash at the patient's bedside for the next cleaning. The mouth prop and bite block should be repackaged and sterilized before the next use. Stop and review this procedure before continuing. You may want to refer to the instructional booklet for procedural outline. The third procedure to be demonstrated is the removing and cleaning of dentures. The materials needed to perform this procedure are denture cup, towel, gloves, denture brush, water, gauze squares, mouthwash, soft toothbrush, emesis basin, petroleum jelly, and cotton tip applicators. As before, tell the patient what you're going to do. Drape the patient with a towel and then glove up. To remove a lower denture, gently but firmly grasp the anterior region. Pull up and out. Place the denture in a denture cup. To remove an upper denture, run your finger around the top border to break the suction seal. Carefully pull the denture down and out by grasping the anterior border. Place the denture in a denture cup. Transfer the dentures in a denture cup to a water-filled basin. The water in the basin protects against breaking the dentures if they should be dropped during cleaning. Scrub the denture over the basin using a denture brush and soap or a mild toothpaste. Rinse the denture well and return it to the patient's bedside in the denture cup. Ask the patient to rinse his mouth well with mouthwash. Use the toothbrush to brush the patient's tongue, or wipe the tongue and mouth with gauze squares dampened with mouthwash. This will remove debris and freshen the patient's mouth. Reinsert the dentures for the patient or allow the patient to do it if he is capable. Apply petroleum jelly to the lips with a cotton tip applicator. Leave the denture cup, brushes, and mouthwash at the bedside and throw away the paper products. Stop here and review the procedure. You may want to refer to the instructional booklet for procedural outline.